Anytime on the NCLEX exam you are trying to answer priority question, trust me, there are more than one answer in that question, right? But what you need to do is to know the focus of the question. Now, the nurse is developing a plan of care for clients with spinal cord injury who has an indwelling urinary catheter. So what's the problem? You are caring for the indwelling urinary catheter. Now, the examiner is saying which of the following would be priority for the nurse to include in the plan of care. So I know every answer here is correct based on the condition, but guess what? Based on the focus, all the answer will not be correct. More than one answer might be correct based on the focus, but all the answer is not going to be correct. Now, let us do this question together. Yes, for urinary catheter, we want to encourage fluid. We want to maintain the urine collection bag in a dependent position. But we don't want to teach the client about fiber, food high in fiber. We don't want to do that because that is not related to the indwelling catheter. That is related to spinal cord injury, but it is not related to indwelling catheter. So guess what? If you don't know your focus in the question, you are going to overthink the two things that is here, the spinal cord injury and the indwelling catheter. But immediately you know your focus, you can easily eliminate this because this is not related to your focus, indwelling catheter, but it's related to spinal cord injury. But the NCLEX is not testing you about spinal cord injury. The NCLEX is testing you about indwelling catheter. So why do I need to think about spinal cord injury? Now, indwelling catheter, I have 3 answers related to it, 1, 2, and 4. Now, the NCLEX is asking about priority. Remember I said, when the NCLEX is asking about priority, there is more than one answer. You need to know what is priority. And when you think about priority, 1, you want to think about either the best intervention based on maybe there's any complication, life-threatening situation. That's what you want to do. But in this, the third thing is risk for reduction of risk. Yeah, reduction of risk, complication, reduction of risk, life-threatening situation. But for this question, right, reduction of risk we apply because the patient has indwelling catheter, and the biggest priority right here is to maintain the urine collection bag in a dependent position. That's reduction of risk because inserting this can cause infection, right? Put the patient at risk for infection. So the priority thing is to prevent the infection, avoid it. So make sure we do something to avoid it. That's why the answer is 2.